the diagnostic textbooks that 80% of headaches are psychogenic, psychosomatic, kind of in your head, and then the doctor would do the rundown, the diagnostic workup, he'd see your x-rays, he'd do your blood tests, and he'd end up saying, look, there's nothing wrong with you. It's in your head, so he'd say stress, and that's where he'd leave it.
Yeah.
But the truth of the matter is we know that actually 80% of those headaches are actually not psychosomatic in your head. It's more, it's actually cervicogenic. It's very much related to stress. It's very much related to anxiety coming from the cervical spine and causing cervicogenic headaches and tension headaches. There's also the other side of migraines, very common, but migraines often have a cervicogenic component, and they're very easily treatable. The key is to try and recognize which one a person has, and a lot of people don't realize that when they get treated for these things, they often get the medication, but that's not necessarily getting to the root of it. It's very important to actually get to the root of it, and once you identify what sets it off, it's much more manageable. They get much more long-term relief, and you're not just treating the symptoms, you're treating the cause.
The whole, absolutely. No, well, that is functional medicine in itself. It's
Sure.
treating the whole with a WH, not just plugging the hole and trying to fix that problem.
I like it.
So, Brett, I mean, you said a lot there and some very big words, cervicogenic. I mean, that is obviously just translating, and correct me if I'm wrong, genic meaning the root cause, and cervico meaning it comes from the neck. Is that correct?
Cervicogenic really means coming from the cervix, well,
Right.
from the neck itself.
Yeah.
The neck and the base of the skull. A lot of people are clenching all day long. It's what I call like chomping at the bit, and they don't realize it. And unfortunately, it does cause a lot of, when you chomp at the bit and you're clenching, your neck muscles are often tensing up as well. And so too, punching of the shoulders, all of those.
And being on our phone all the time.
That's a big candidate.
Text neck.
Yeah, we call it tech neck. That's exactly it. Text neck or even tech neck. I've seen both terms, but yes, we're big texters, and unfortunately, this is the result. It's one of the afflictions of the generation.
And then obviously, I mean, that's associated with a lot of different chronic pains. And I think we kind of often miss the early warning signs. You'll get a bit of a dull headache, or you'll have brain fog, and we'll leave it. And we'll take, I know my husband is a big fan of Panado, and he'll take 2, and then a bit later it's not going away, and he'll take another 2. And that is, I think, trying to put the plaster on rather than treat it properly. So I think, I mean, maybe when do you kind of say it's time to get it addressed by a healthcare professional? Like, how long does a headache persist for?
So if you start seeing, like, if you just have a headache that's starting to persist and it's becoming chronic, meaning there's often early warning signs. You'll find that the person will start with a bit of an achy neck and a bit of a low-grade headache, and he says, I live with it. But then the music starts getting a little bit louder. You'll feel that your head almost feels too heavy on your shoulders. You'll feel like it's tight. Like my patients often walk in there and say, I can't hold my head up. It's so tight. It's heavy. And it's not heavy. It's just that what's happening, your muscles over time are starting to shorten from that constant contraction. And as a result of that, and due to the bad posture, the stress tensing up, the muscles shorten and almost like lashes down your head and pulls it down, and you actually feel very tight. Those are already the beginning stages where you're already at that stage, you should be calling in to get some treatment, because left unchecked, it becomes more of a chronic headache that gets much more long-term, and instead of being a few minutes here or there, it starts becoming hours and then days.
You get used to it.
People say, I'm used to it. It's my usual fix. The truth is you shouldn't get used to that, because there's also secondary effects on that. A lot of times when you get that tight neck, tightness in the musculature, you also get restriction in the joints as a result of that, because the muscles are tethering the joints hard against each other, and that starts wearing the joints down. And that's when the nerves start getting a little bit pinched. So each one flows into the next. It's a continuum. And the key is to identify right at the beginning. Instead of treating structural changes, we want to address the functional changes before they start becoming structural changes. And we can slow that down right down if we address it early.
If you address it early. So tell me, what is the common protocol? I mean, people have different perceptions of the difference of a physio and a chiro, and everybody thinks you just come to the chiro to get your back cracked.
Right. So look, the chiropractors in this country, particularly very diagnostically oriented, we get very accurate with our diagnoses. So basically, if you are diagnosed with a headache, we don't just look at you've got a headache and you've got muscle tension, we look at the backdrop behind. Why did you get it in the first place? We address your ergonomics for one, which is sitting at work, how you're sitting, your posture. We also look to see which things in your body are playing with what, because your body is, if you can say, it's almost like a kinematic chain. It's a biomechanical chain. You know, the old age saying, the head's connected to the neck, which is connected to the chest, the hip bone, to the knee bone. So it's actually very true. In the old days, they used to be very compartmentalized and say, okay, this is your area of your problem, and they just treat that. We know, and we've been saying that this has been for a number of years, particularly overseas, this is very, very big, is looking globally, and we see which part of your body is playing with which part and what setting. So your shoulder might have a little bit of a restriction somewhere, and as a result, your neck muscles might be working harder against that shoulder. And you need to identify that and treat that as well. Once you do that, they're not playing, each section is not playing ping pong with the part next door. And then you get a much more long-standing response. So we don't just adjust or click your neck, so to speak. We'll work on the musculature. We'll work on the joints. We'll also work on the parts of the body that are adjacent to it that may be affecting it and loading it up much, much more. Because each part is going to be working harder if the part next door is not doing its job. Right. It's very important to address that as well. So we look at the whole biomechanical chain, we treat all the components correctly, and then you actually have incredible relief and functionality. You don't feel that tightness on your shoulders, and you don't get those headaches nearly as much as one would normally get.
Right. I mean, I've come to you, Brett, for neck tension, and it's amazing how you feel afterwards. And I think it's a very thorough analysis that you do. Also a very good preparation. You know, if there is going to be a need for the acupuncture and the needles, it's about preparing the body, mobilizing, heating. And then those one or two needles, like you say, when they release that nerve and you feel that, you know, little twitch, everything does reset. And maybe you can also, I know it's a bit off script, but how does the acupuncture actually work for headaches and neck pain?
So I'm glad you brought up that topic. So that's what we call myofascial trigger points. It's a fancy medical term for muscle knots. So in the old days, they used to think the muscle knot is a... Let me just backtrack one sec. So these myofascial trigger points of muscle knots are big, big proponents for causing headaches. In other words, each one or each independent muscle has its own area. Depending where the point is in the muscle, which trigger point or muscle knot is active, it will refer to a particular part of your body. Okay. So, for example, on your upper shoulders, you can have 2 or 3 there, and each one to go to over your eye, want to go behind your eye, one to the back of the head, and they can be active, and you don't realize it. You might have gone to the GP, and he said, look, there's nothing wrong with you. I can't find anything. Live with it. But meantime, people are sitting with these muscle knots, and they call them myotonal referral pain patterns, not just a nerve referring. Your muscles can refer to different parts and give you big headaches. So when I was in my study days, in fact, the dry needling actually came through our program. It was the first one coming into the country in the early 1990s. Chiropractors were very, very big in treating with the myofascial needling of myofascial trigger points. We inactivate those trigger points to actually make them, once they calm, no more headache. How it works is, I think the question was, it's very interesting. They used to think it's a muscle knot, except when they go to biopsy it, there's no muscle knot visible. So it's, what is this thing? So it's very interesting. So we know that every nerve always goes to a specific part of the body. But there's also branches off those nerves and tributary branches, much like a tree with the branches, the sub-branches, and the twigs. So those sub-branches always go to the same places in every person. And in terms of the nerve, you have a little tributary branch sticking its feet into the muscle. And if that nerve is a bit irritable, or if you want excited from anxiety, stress, it makes lots of activity, you're hunching a lot, it fires into the muscle, makes the muscle pull, and it makes a localized area of spasm. And that localized area of spasm is that muscle knot that you're feeling. And it's always the same points in every person. You can actually anatomically map them out. The reason they're always the same place is because the nerve is firing into the muscle, makes the muscle pull, and you feel like this tight knot. And that's really the mechanism how it works. When you needle it, you're almost overstimulating that area, your central nervous system, is what regulates your muscle tension. If you could find a way to actually change that regulation, the nervous system lets go. It's a very similar principle how stretch works. When you're stretching, you're actually lengthening that muscle. You're making it a bit tighter initially. The nervous system picks up on that added stimulation, and it turns the volume down. And a reflex relaxes. That's how muscle relaxes. So when we stimulate the needle, it picks up the added stimulation, and a reflex relaxes the and the actual
changes
the whole regulation, and the muscle
yeah.
lets go. And you actually feel it let go soft like putty.
Amazing. Now, I do talk about that quite a bit in yoga classes, because everybody comes in here sympathetic nervous system stimulated, fight and flight, like they're being chased by a tiger.
Everyone is on fight and flight.
And then it takes time. It takes time to settle, to breathe, to get into the parasympathetic nervous system and rest and digest. And I even as an instructor, have to always remind myself when I'm coming home and I'm in a rush and I'm flustered, just sit down and hum a little bit, or breathe, or have some hot water.
People have forgotten how to breathe. It's one of those skills that they've lost. You need people to teach you how to rebreathe. And Haley's a master of that. That's really what needs to be done.
Don't know so much about a master. Practice what I need to do for myself. But so interesting. And I mean, I would guess that the way that you would treat a headache, it also varies depending on the type of the headache, right?
Correct.
So, I mean, if someone has a migraine versus a cluster headache, is there a different protocol? What makes it different?
So look, migraines and enigma cluster headaches are very much more, not as common as migraines. They're different types of headaches. Majority headaches are cervicogenic. Migraines there's different theories explaining what the cause is. They haven't quite got down to the nitty-gritty of what actually is a migraine. Is it vascular, neurogenic, or both? It often is both, it seems to be. There's often a cervicogenic component, so that we treat them and give them relief from that perspective. But when it's something that's not necessarily coming from the neuromuscular skeletal system, be it what they call the vascular headaches, what we call benign idiopathic hypertension, you get what we call intracranial hypertension. These are rarer headaches. Those we can't treat. Those we refer. It's very important that you accurately do a case history to pick these headaches up, because if you find them, you've got to refer straight out. They're very rare and they're not common. So if people are getting scared of these things, no, they're not common. They're very rare. That's always good. If you see your chiropractor, he's got to assess you thoroughly.
Absolutely.
If he picks it up, he will refer you to the relevant specialist that they'll treat it correctly. But as I said, the vast majority are actually more related to the neuromuscular skeletal system, coming from the neck, coming from the jaw, the TMJ often playing a big role, which we haven't got to yet. And those we can treat very effectively.
And I'm so pleased you said that, Brett, and I'll share with you a little story I don't think I've told you before. But when I was in my early 20s, I had a bad headache. It wasn't going away. And I was traveling to Cape Town. And I got on the plane, and the headache started getting worse. Got off the plane, and it was another level. And it was quite a traumatic time. My grandmother wasn't well at the time, so I kind of pushed my own stuff aside, and I can't worry about this headache. But it got so bad that I couldn't keep food down. It was so intense, the pain, and I was taking Cataflam and anti-inflammatories, anything that was given to me, a glass of wine. I tried everything to try dull this headache. And it actually came out that, once I'd seen a doctor and had a scan, because I passed out from the pain of this headache, that I had a clot in my brain. It was a frontal lobe clot, and it started off as a little headache. And that's why I think it is, as you say, and as I say, I appreciate that you say, go and see someone, and you would refer. If you say, no, this is not normal, this is past the point of we're going to put some needles in your neck. Headaches can be caused from so many things, and my root cause, and I will share it because I think it's important to say, is it turned out that the root cause of my headache was from being on a contraceptive. It says in the little leaflet, 1 in 10,000 women have a chance of having a thrombosis as a result of the contraceptive, and that was what it landed up being. And another cause can be as simple as dehydration. You can be dehydrated and have a headache. You can be heat stroke and have a headache, or you can have a serious problem. So I think headaches are something not to be treated, disregarded.
Correct. They shouldn't be treated lightly. But generally, they're very key red flag giveaways. If you're not a headache sufferer, you start with a headache out of the blue, it's very severe, it's unrelenting, getting worse. Those are some blurring of vision, going with it, vomiting, and as you say, you're feeling dizzy, etc. Those are some of the red flags to take. But if you get, your normal headache, it's been coming for years. Those we don't worry about. You don't have to lose sleep over them. Very easily treatable when managed correctly. But just important to recognize that yes, you can sometimes get these severe headaches that do happen. They're rare. And you can generally pick them up straight away. You refer to relevant professional, and they treat them accordingly.
Right. So before we sign off, I think that we've spoken a lot about the treatment and the causes, and for me, it's prevention. Prevention is the best treatment of all. And maybe you can just share with us some tips and guidelines on how you would avoid, as you say, getting the jaw locked or the neck pain. I would love to just turn around and say, can you show us on my neck what to do? And you're welcome to, but maybe just a few posture correction techniques, stretches, and everyday tips.
Okay, so one point I just want to mention is that a lot of people, I brought it up at the beginning of this session, is that people when they're sitting, they're often, your head's like the weight of a bowling ball, it's like 5-6 kilograms. And it's heavy. Your muscles around your neck, the upper trapezius, posterior cervical, sternocleidomastoids, they are what keep your head centered on your body, and they're strong muscles, and they can do their job well. They're your anti-gravity muscles. What often happens, though, is because once you move a little bit forward, be it over, in the old days, everyone was doing the computer. Then it became the laptops that went a bit more forward. Now we're on flat screens. Now we're right forward. So now your head is really being under load. So every bit that you move forward, you're going to find that your muscle contraction is going to amplify 2 times, 2-fold, 3-fold, 6-fold. It's exponential. As every centimeter you move forward, it's working much harder. So it's one thing to go to gym and you pick up a weight, a 5-kilogram weight, and now you can see me contract, relax, contract. That's building muscle strength. That's an eccentric, concentric loading muscle. There's another one which is the resistor isometric contraction. I work a lot of powerlifters. They sometimes hold these things. You see, they can't straighten the arms after a while. They're holding the muscle, the weight for so long.
Keeps you in business, the powerlifting.
Yeah.
And the paddle.
Yeah, very much so. So when you have a contraction of your muscle, you're leaning forward. So these muscles are working and they're contracting. They're not going to gym up and down, up and down. They're holding a sustained load for a prolonged period of time. In that time, those muscles start to shorten, because they instead of contracting now from a fully lengthened position in, I don't know if you can see this, instead of starting over here and coming in, they'll start halfway, because their resting position is no longer a lengthened position. Their resting position is semi-contracted to start, and that's really the warning signs. You feel your head's heavy on your shoulders, it's too tight, I'm tired, I'm fatigued. Those are really the giveaway clues to get treated. So what you've got to do to counteract that is, one is ergonomics. For example, when you're sitting at that computer or that laptop, if you're sitting, you've got to make sure your chair is as close to the keyboard as possible, so that you're not reaching forward, going over. That's one step. You can put a lumbar support cushion behind you, even if you can't do that, if your chair doesn't fit under the table. Something just to keep you, everything has to be close to you, keyboard close to you. One is monitor in front. These are obvious things that most people know. What people don't realize is also your keyboard. Even if you're sitting correctly, you're positioned correctly, your keyboard, your monitor is the right height. If your keyboard is flat, you are going to go forward to reach that keyboard. And again, you're working those muscles over time. So you want to angle that keyboard, and you want to play with different angles. Even in the early days, everyone is thinking carpal tunnel syndrome, proper keyboard up so you don't hurt your wrist. No one is thinking neck in those days. But even more importantly, we realize that keyboard doesn't have to be propped up just for your wrist when you're typing. It's got to be propped up, angled, so you can sit back when you're typing. When your keyboard is lifted at a 30-degree angle, 40-degree angle even, you can sit back in the chair. Your head's much more neutral, much more aligned. That's the one thing in terms of ergonomics. The other thing is sleeping position. Very common. People sleep soft, big puffy pillow, soft. The head kind of not supported because it's so soft. The head kinks over to the side. It's almost sleeping on the joint, even on the nerve. If they're a little bit older, there's a bit of degenerative change. They're sleeping on the nerve. They wake up, oh, I can't turn my head. What happened? I did nothing. But really, you're sleeping on the nerve the whole night. You want your pillow to fill in the gap in your neck when you're sleeping, that your head is midline. It's got to fill in all those gaps. If it doesn't fill in those gaps, your muscle's going to be contracting the entire night. And you're going to feel tight when you wake up, and the headache, maybe a little bit of a nerve pinch because of it if one is a bit older. So those are some of the points. In terms of prevention, even bang for your buck, stretching. I'll give you one exercise to do that is really bang for your buck type exercise that in terms of time, because I know no one has time to do it. So I'm going to, Haley, if you don't mind, I'm going to demonstrate on you. Okay?
Must have to come in front of me to the side?
Yeah, I'll come behind you.
Okay.
So you can see me. But this is Haley's neck. So we're going to stretch this muscle over here.
My poor neck.
Haley's case is quite shortened. Yeah. So what we're going to do, you basically, in fact, Haley's going to do it. I'm going to show her how to do it. She's going to put her hand on her head like this.
All right.
And she's going to take a breath in, and she's going to, as she breathes out, she's going to pull, just to get a biting stretch, and she can feel that pull ready. It's going to actually, as you do that, you're going to lengthen your muscles back out again. You hold it for about 6 or so seconds. But again, people don't have time to actually do long stretches. So what you do, we do this a lot with our athletes. We call it PNF stretching. You come back a little bit to neutral. You keep your hand exactly where you were. And what Haley's going to do, she's going to try and push her head towards her hand, but her hand doesn't let her head move. So she's going to try and move this way, the way my hand is moving.
Okay.
So she's going to resist that movement, trying to contract. Then she's going to stop. She's going to take a breath in. She's going to breathe out. And she's going to let it, now she's going to pull it over.
Now stretch, okay.
She's going to stretch it for a bit, a few seconds, maybe 5 or so seconds. Come back. And then she's going to push again into her hand, like that. She's going to push this way. With her head and
so there's a resistance.
Stabilizing that movement, not letting it go. She needn't push back hard, just a little bit of a force, not hard at all. Then she takes a breath in, she breathes out, and then she pulls over. This is called PNF stretching, starts with proprio neuromuscular facilitation. It amplifies that stretch.
Wow.
I'll just show you
Feels
myself,
good.
just like this, pulling over for 6 seconds, then I push back that way. And then I go again, 6 seconds stretching, push back. The pushing back causes a reflex relaxation of the muscle. It amplifies what normally takes 10 repetitions to get a certain range. You'll get it in 3 to 4 repetitions. Much quicker, much more effective. You can do it at the robot while you're waiting for the robot to change. You can do it while you're on the phone. It just little key tricks to get your muscle to lengthen back out to that normal resting position that it once used to be. And I guarantee you, if you do it for a month, your muscles will be far more lengthy and flexible. Your head will not feel heavy on your shoulders, and you won't be getting those headaches nearly as much. Also, your muscles will be stronger in strength. Because if your muscles are contracting from a shortened position, which is the resting position, for a lot of people, it's semi-contracted, they straight away weak. They go to the biokinetic system and say, oh, you're weak. But no one ever says, why are you so weak? It's often because your muscles are semi-shortened to start. Get them lengthened back out. They're no longer contracting from a semi-contracted position. They're contracting from a fully lengthened position. Their strength comes back straight away. They're much, much stronger in their strength. That's one part of the puzzle. The biokinetics and physios also explain other parts, but that's one crucial area that I do believe is often overlooked.
Amazing, Brett. Well, we are at the end of our show. It's the time to get back to your patients, to my classes, and I just maybe to end off just to share where people can find you here, how do they book or contact you. We'll share your details as well in the bio. But fantastic, learned so much, and I think, like you said, it's just kind of one piece of the puzzle, and we could probably talk for so much longer about how to unlock the jaw and the clenching. I think that can be part 2.
So we're at the Long Avenue Medical Center here in Glen Hazel. You can reach us directly through my cell number, which is actually also online. My website is online. It's Dr. Brett Kavonic. And Haley's got her website as well. We're all connected. We work as a multidisciplinary team here. Everyone's very effective at what they do. We collaborate with each other. And it's a very, very special environment. And you can even come here for a coffee.
That's true. We can definitely. And also just wanted to say I appreciate you, Brett, and all that you've done since I've been here, making me feel very welcome, referring your clients over for classes. And it really is a special place to be. We are, as you say, multidisciplinary. It's integrative. We refer between us, and I'm very blessed to work with professionals like yourself.
Thank you for having me on the show.
Thank you for being here and have a beautiful weekend, everyone. Until next time,
Thank you.
keep evolving.